Welcome back. My name is Eric Abelos, and in-house today for our COVID-19 update, we have Dr. Sainer. Doctor, how are you doing?
Hi, doing well, thanks.
Awesome. Well, thank you for joining me this morning. I know that things have kind of calmed down in the realm of COVID-19, but could you tell me who you are, who you work for, and how that relates to COVID-19?
Absolutely. So, again, my name's Laura Sainert. I'm the Chief Medical Officer here at UCHealth Yampa Valley Medical Center. I'm actually also one of the emergency medicine physicians, so I work over in the ER as well.
Nice. And so that's got to keep you fairly busy.
To say the least.
So I haven't been to the hospital in a long time, but I've seen some pictures of some of the COVID-19 treatment centers where they look like they're something out of ET, where everything's like taped off and everything's white. Does it look very similar in the hospital nowadays?
It does not look like ET. No, it does not.
Okay.
So, we absolutely have everything we need to be prepared. So certainly at times we are garbed up in all of the PPE and the face shield and the gowns and the masks. But I think importantly, just to know we're here for everyone. We're here to care for COVID, for people who are concerned they might have COVID, for people who have absolutely nothing to do with COVID and just need our help. So, ultimately our goal is just to be here to care for patients.
That's awesome. And thank you for being there. Thank you for being on the front lines. We as a community need you and appreciate you. What are we doing? What do we need to be looking out for going into flu season? I mean, it's here or it's right around the corner. And I know some of those symptoms kind of can overlap between COVID and just regular flu. So what are we doing to prepare for that?
Well, as an ED doc, I'm very thankful for a lot of the COVID precautions that have taken place, as it really carries over into cough and cold and flu season on every level. So all of the same stuff that people have been doing: washing your hands, staying home if you're sick, keeping a good social distance, covering your mouth, all of those kind of things will help the cough and colds, the flu, all the respiratory viral season. So I think the best message we can do is keep on keeping on. I know that this is trying on everyone. I know that it gets exhausting and we all want normalcy back in our life, but what we're doing is working, and we just really need to keep it up, especially moving forward into flu season.
Totally. And for a while there, I was like terrified to get sick or fall and hurt myself because I didn't want to go to the hospital. I just thought of the hospital as this like, if I go to the hospital, I will get COVID-19. Can you tell us that is the way or is not the way?
Yeah, we want to reiterate again and again, we are doing everything we can to keep you safe. And so that's just first and foremost on every single person's mind, is keeping our staff safe, keeping our patients safe, and making sure that we are here to care for you. The hospital has done remarkably well through the COVID pandemic. So since the pandemic started, the UCHealth system as a whole has cared for, I believe, over 2,000 patients. But here at Yampa Valley, we've actually had 8 hospitalized patients, which just speaks volumes to how incredible our community is, how incredible, what a team effort this has been to keep people healthy and keep people out of the hospital.
Yeah, we've been speaking with Dr. Harrington every week, and we recently talked with one of the the contact tracers as well. Do you have any hands in on that?
Well, again, reiterate, this has just been a huge team effort. So between public health, between our primary care providers, between, Dr. Harrington and his team, I feel like I could go on and on like the Grammys. Thank you, Mom and Dad. Thank you, my family. But really, so many kudos to the team for making this work. So sure, we are in communication on a very regular basis with public health, just to make sure we're all, in this effort together.
Yeah, and definitely the people in charge need the recognition, but also you at home need the recognition as well for staying home, for wearing your masks, for washing your hands, for staying 6 feet apart. We really appreciate you too. Do you agree with me?
I couldn't agree more.
Yeah.
I've always loved Steamboat, and I couldn't be more proud of our community.
So what else do people need to be aware of with UC Health?
Well, I think importantly, again, as we move into cough and flu season, is just, an important part as well is to get your flu shot. We are encouraging everyone. I know that it seems early, but really, the last thing we want to do is have a bad flu season on top of the COVID pandemic. So we really want people to get out there, get your flu shots, get them early, and continue with all of the same precautions that we've been talking about.
So, Dr. Sander, is there anything else that we need to be aware of that's going on at UC Health?
Sure. Well, I think just remember that this is what we do. This is what we train for. This is what we prepare for. So, without the COVID pandemic, we're always thinking, what could happen? What do we need to worry about? Mass casualty incidents or plane crashes or other drills that we need to go through. So this is part of what we have been preparing for. So since April, we've been doing drills and worrying about what if this happens and what if we do see a surge? What are our next steps? So just know that we are continually reevaluating, continually looking at the landscape of the community, of the state, nationwide, and really just making sure we're as prepared as we can be. This is sort of our normal hospital operations to make sure that we're prepared. And this is just really tightened up. I think having the partnership of UC Health across the state has just been such a valuable asset for our small community. We've really got access to the infectious disease experts, but the supply chain within UC Health, and just all of the support that we've gotten from the UC Health system has really benefited our community, and we're prepared. We're here for you, and we just appreciate your partnership in the community.
Of course. And so you guys are not just here to keep us safe, but you're here to help us feel safe as well. Like we're all taken care of. Should something arise, we're taken care of. Well, thank you so much for joining me this morning. I really, really appreciate you. I know you are busy, busy, busy. So thank you so much.
Thank you. Thanks for your time.
Of course. Guys, stay tuned. We have a bunch more show coming to you right after this.